So, hello, how are you doing, guys? With you, Dr. Hamid, an ECPMG certified physician. We've got a high yield topic for today, which is lung cancer. So, lung cancer is pretty deadly. It is the leading cause of cancer this worldwide. So, there are common symptoms for lung cancer, such as cough, hemoptysis, and wheezing, muscle like weight loss, cachexia, and they are not pretty specific for lung cancer. For example, hemoptysis, you may find it with pulmonary edema, bronchiectasis, and the cough. It may happen with like pneumonia and bronchitis. So the next step is to do some imaging, chest X-ray and the CT scan. So the lung cancer is subdivided into two big groups, the small cell lung carcinoma and the non-small cell lung cancer. So the small cell lung carcinoma has like a pretty specific location. It tends to occur central in your chest. So you have to memorize this is a very high yield point. So the small cell lung cancer plus the squamous cell carcinoma occur centrally. They have central location in your chest X-ray versus adenocarcinoma, which occurs peripherally, for example. So the behavior of small cell lung cancer, it has like an aggressive, very aggressive tumor and has undifferentiated histology, and it has like a very important like thing, which is paraneoplastic syndromes. So the paraneoplastic syndrome of small cell lung carcinoma, they are highly tested, specifically the endocrine ones. So they are neurological paraneoplastic syndromes and endocrine paraneoplastic syndromes. The neurological paraneoplastic syndromes include Lambert-Eaton myasthenic syndrome. So it's like muscle weakness and due to substances like associated with small cell lung cancer, and it causes like anti-calcium effect. So by this way, it can uh, calcium channel anti-calcium channel. By this way, it's gonna cause like muscle weakness and also paraneoplastic myelitis, paraneoplastic encephalitis, and subacute cerebellar degeneration. So whenever you find small cell lung cancer and one of these, this is like paraneoplastic syndromes of small cell lung cancer. And what is most commonly tested is the endocrine paraneoplastic syndrome. For example, if you've got like a patient who has a chest X-ray with like suggestive lung cancer plus a sodium of 120, 125, this is SIADH. So this is an endocrine paraneoplastic syndrome, syndrome of inappropriate antidiuretic hormone. So whenever there is increase in the antidiuretic hormone, there is increase in water retention. So when you with this water retention, it's gonna be like hyponatremia. So this is when you find in a vignette a patient who has like again lung cancer plus low sodium. So this is SIDH, and also Cushing's syndrome may happen as a paraneoplastic syndrome associated with small cell lung cancer. For example, there is a suggested this is through like increase in the ACTH. So the ACTH is the mediator here. It increases and it's gonna like cause Cushing syndrome with all of its manifestation: hyperglycemia, hypertension, the striae that is a characteristic of Cushing syndrome. So you have to watch for any of these accompanying lung cancer. So this is mostly like a paraneoplastic syndrome of this lung cancer. So the location again is central location and differentiated very aggressive tumor, and the treatment is primarily chemotherapy. For you have to give like chemotherapy plus radiation. So you may give chemotherapy with or without radiation. So primarily you have to give chemotherapy. And regarding the histology, it arises from specific cells called neuroendocrine cells called Kolchitsky cells. So this Kolchitsky cells has like basophilic appearance as appears here in this histology picture. So it's like basophilic neuroendocrine cells, Kolchitsky cells, and it has like a chromogranin A positive, neuron specific enolase positive, synaptophysin positive. So these markers you have to memorize them. So again, chromogranin positive, neuron specific enolase positive, and synaptophysin positive. So this is all for small lung cancer, like the location, like its behavior, the treatment, and the paraneoplastic syndromes of small cell lung cancer. Then we gonna talk about like non-small cell lung carcinoma. It is subdivided into adenocarcinoma, squamous cell, and large cell carcinoma. So first is adenocarcinoma. It has a peripheral location, as we have just said, and it is most common like in non-smokers, and the female occurs more commonly in females than in males. So this is a very high yield point, and non-smoker is a tumor not related to smoking. Very high yield point is that to know that adenocarcinoma is not related to smoking. And there are some specific mutation you have to memorize: this KRAS mutation, EGFR mutation, and ALK mutation. So KRAS, EGFR, and ALK mutations are associated with adenocarcinoma, and the clubbing is common. Another name, which is hypertrophic osteoarthropathy. So hypertrophic osteoarthropathy is associated with some conditions such as bronchiectasis, for example, and cyanotic congenital heart disease. And here is pretty associated with subdivision of non-small cell lung carcinoma, which is adenocarcinoma. So this is like and picture of like adenocarcinoma. It has like mucin and the stain positive for mucin. This is adenocarcinoma, and squamous cell carcinoma. It has like central location, which is the same as a small cell lung carcinoma, and they link it to smoking versus like adenocarcinoma, which is not related to smoking and can cause hypercalcemia. This is another high yield paraneoplastic syndrome. So this is paraneoplastic syndrome associated with squamous cell carcinoma. This is mediated by something called the parathyroid hormone related peptide. So for this patient, when you like do some lab tests, and you will find the parathyroid hormone normal. So this is kind of tricky. So parathyroid hormone itself is normal, but parathyroid hormone related peptide is the thing that is increased in squamous cell carcinoma, and the thing is gonna mediate like hypercalcemia in the patient who has squamous cell carcinoma. And on histology, it's like keratin barrels and like desmosomes and intercellular bridges. So on like chest X-ray, you may find like cavitation. So the cavitation is like pretty specific for squamous cell carcinoma. So cavitation on chest X-ray, and the keratin barrels on like as here in like on the histology keratin barrels. So and the next subdivision of non-small cell lung cancer is large cell carcinoma. So again, it has like a peripheral location, and is highly anaplastic. Large cell carcinoma is very aggressive, highly anaplastic, with poor prognosis, and the treatment is surgical treatment, and may produce like gynecomastia by secreting HCG. So it can secrete HCG, and it can cause gynecomastia. So to recap, like the paraneoplastic syndrome, or like things associated with like lung cancer. So large cell carcinoma is associated with like gynecomastia through HCG. Squamous cell carcinoma is associated with like hypercalcemia through parathyroid hormone related peptide. Adenocarcinoma can cause like hypertrophic osteoarthropathy, like clubbing, and of course the paraneoplastic syndromes of small cell lung cancer, the endocrine one Cushing syndrome and SIADH, and the neurological one Lambert-Eaton myasthenic syndrome, paraneoplastic myelitis, and encephalitis, subacute cerebellar degeneration. So you can like put some effort in memorizing them well. So, so there's some high yield subtype of like Bancost tumor and superior vena cava like syndrome. So Bancost tumor is like a type of lung cancer which has like a specific location. It has like it occurs like upward in your chest near like the blood vessels and the brachial plexus. So having like this specific location is gonna cause some compressive symptoms. So it can compress the nerves. So when it compresses the stellate ganglion, it can cause Horner syndrome. So ptosis, meiosis, and hydrosis, dropping of your eyelids. The eyelids is gonna constrict, the pupils is gonna constrict, and there's like no hydration or like no sweating on one side of your head. So this is like Horner syndrome. And the cause is due to compression of stellate ganglion by the tumor. So also hoarseness. This is occurs due to like uh, pressure on the recurrent laryngeal nerve. So when this tumor like compresses the recurrent laryngeal nerve, is gonna cause like hoarseness and the pain. The pain occurs due to the compression of the brachial plexus. So the when the tumor compresses the brachial plexus, can essentially cause any symptoms. For example, shoulder pain, sensory motor deficit. So according to the nerve root or the nerve branch compressed of the brachial plexus, it can cause like all of the sensory and motor deficits in your like arm, and atrophy, for example, intrinsic muscles of the hand, anything. And another high yield thing that can cause like Bancosta tumor can cause a superior vena cava syndrome. So superior vena cava syndrome can be caused by Bancosta tumor. Also, it can be caused like by, for example, central venous catheter, like causing some thrombosis. So either some thrombosis from within the vessels, or being like compressed from the outside by Bancosta tumor. So the blood is gonna be, the pressure is gonna be stagnant. The blood is gonna be stagnant, and the pressure increases backwards. So the superior vena cava is like compressed, and the blood will go back in your head and in your arms. So there's like edema in your head, in your arms, and even like the pharyngeal edema, laryngeal edema. So the pharyngeal edema is gonna like affect your pharynx, and laryngeal edema is gonna cause like hoarseness, and there's like upper limb edema or head edema. This it may even cause like, for example, like rupture of aneurysm in your brain, and the headache, and all of these neurological symptoms. So this is due to like the back pressure of the blood is not gonna reach easily to your like right atrium from the superior vena cava. So this is superior vena cava syndrome, and it has like pretty specific characteristic when you like press on your the skin of the patient above like the obstruction is gonna cause blanching after you press on your patient's skin. So this is for superior vena cava syndrome, and there are another like tumors like lung cancers, hamartomas. They are like incidental with circumscribed lung masses on imaging, and bronchial carcinoid tumors. They are like may occur central or peripheral. So for every tumor, it can occur either central or peripheral. So bronchial carcinoids has like a specific thing being occurring like both central and the peripheral, either. So rarely metastasize and has like good prognosis, and can cause like carcinoid syndrome. So remember, carcinoid syndrome, it primarily it either occurs due to bronchial carcinoid tumor, or it may occur due to like intestinal like carcinoid tumor. So the intestinal carcinoid tumors have to like metastasize in the liver to cause like carcinoid syndrome. So as long as it stays in the intestine, it's not gonna like cause the symptoms of carcinoid syndrome, such as like wheezing, flushing, diarrhea. This is because the intestine is drained by the portal vein, and like the serotonin, which is a mediator for for the carcinoid syndromes in general, when it like it is drained from the intestine, it's gonna go to the liver and be detoxified. So the intestinal like carcinoids have to go and metastasize into the liver to cause like carcinoid syndrome, versus the bronchial carcinoid tumors is gonna cause carcinoid syndrome directly. So it is gonna like pour serotonin directly into your like systemic circulation. So it's gonna cause carcinoid syndrome. So risk factors for lung cancer, we all know of all of them. Tobacco smoking is like the primary risk, including like second-hand smoke. Even second-hand smoke is a risk factor also for lung cancer, and environmental exposures, radon, asbestos, radiation. So the people like who has like occupational hazards, like uh, for example, the radiology, the technicians. So other factors such as pulmonary fibrosis and family history such as EGFR mutation. So the people having EGFR mutation are increased for lung cancer. So the sites of lung cancer metastasis, it can metastasize into liver, adrenals, bone, and brain. So these are like the four sites that lung cancer tends to metastasize for. So if you have like an accompanying symptom such as jaundice, hepatomegaly, so it's probably metastasized into your liver, adrenals, or pathological fractures. So it is gonna, this means it has metastasized to your bone, brain, of course. So and lung metastasis versus primary tumors. So it is a high yield point to know that the most common cause of lung cancer is metastasis. So also we have talked about small cell lung cancers and non-small cell lung cancer with all of their subtypes. like metastasis remains the most common cause of lung cancer. So lung metastasis are the most common cause of lung cancer, and you like know that these are metastases by they have usually like multiple lesions in like maybe in both of lungs in the different like loops. So by this way you're gonna know it is metastasis, not a primary tumor. So the primary source for these metastases is like breast, colon, and the prostate. So the breast and the colon and the prostate, they are like the most common sites that gonna metastasize into your like lungs. I hope you guys enjoyed our video today and see you guys in next videos. Thank you.